name is Marco Viceconti. I'm a full professor at the University of Bologna in Italy, and I'm also the director of the Medical Technology Lab at the Rizzoli Orthopedic Institute, one of the research hospitals also based in Bologna. By training, I'm a mechanical engineer, but I actually never worked as a mechanical engineer. From the very beginning of my career, I was fascinated by biomechanics and in general bioengineering. So I worked for many years in the field of orthopedic biomechanics. But then in the last 20 years, my main focus has been what we now call in silico medicine. So the use of computer modeling and simulation to support the medical decision or to evaluate the safety or efficacy of new medical products. Well, a lot of things. So let's start with in Silico World. In Silico World is a European Commission funded project in the frame of the Horizon 2020 framework. It started the 1st of January 2021. The aim of the project is to lower a number of barriers that are slowing down the adoption of in silico trials. In silico trials are the use of modeling and simulation technology to evaluate the safety or the efficacy of new medical products, new drugs, new medical devices. And in spite of the huge potential of these technologies, the adoption is still very slow. We believe that there are a number of barriers, educational, regulatory, cultural, technological, and so on. And the goal of In Silico World is to try to lower these barriers with a series of targeted action. We're also working on a number of other in silico medicine projects. With my team, we are providing the verification and validation activities and the regulatory activities in the Strituvat project, where we are developing an in silico trial to test new treatments for tuberculosis. We are responsible for the regulatory work package of Mobilized, where the idea is to use wearable sensor as mobility monitors in drug trials. We are responsible for the multi-scale orchestration in the PRIMAGE model, in the PRIMAGE project, where we are developing a multi-scale model of cancer growth and treatment, and so on and so forth. I mean, but all our activity is related to in silico medicine. The sky is the limit. Well, you know, this is not a difficult prophecy to make, because the medical sector is the absolute last industrial sector that is going through this revolution. So we know exactly the impact that modeling and simulation has on any other industrial sector. I mean, the day we stopped crashing whole cars to evaluate the passenger safety of new vehicles, the whole automotive industry started to change radically. And today, vehicles, cars are infinitely safer than they were before this introduction of modeling and simulation. And this argument can apply to many other industrial sectors. In biomedicine, it's been very difficult for a number of reasons. First of all, modeling living organism is a lot more complicated than modeling inanimate objects, but also there has been a number of cultural and organizational resistances. But the promise is exactly the same. The day that we will have a fully integrated in silico component in the development of new medical products, we will be able to shorten the time to market dramatically, reduce the investment necessary to bring a new product to the market, increase the safety, and in general, do a better job in learning from our mistakes and reuse experience, something that really, especially in drug development today, we don't do. When a drug arrives to a phase 1, phase 2 clinical trial, something goes wrong, we don't learn anything from that. It's just a blunt Halley. We forget about this. I think that in silico trial could help us to go back, improve something, and try again, and succeed many more times that we do succeed today. I could have given you a beautiful answer before the COVID. Predicting the world after the COVID, it's very difficult in any area, in any sector. Okay, so I don't know, but I mean, COVID aside, I think that the most evident problem is the cost of innovation. I mean, the cost to bring a new drug to the market has been growing exponentially in the last 20 years. The same is happening to medical devices, although a little bit more slowly. I believe that the introduction of the medical device regulation in Europe will further exacerbate this problem also for medical device, because the new regulation raised the stick. So bringing new medical device to the European market will be very, very demanding in terms of regulatory burden. The industry is struggling to keep up with the innovation. Also, this huge investment that are necessary to bring a product to the market create a very high entry barrier. So it's very difficult for new player, for newcomers to enter this market. Okay, if in silico trial can, as I believe, dramatically reduce the time to market, the cost, the investment required to bring a new product to the market, this could be really a game changer in so many ways.